All right, welcome back to ABA Exam Review and our latest BCBA exam practice question series video where we go through the next set of questions together and break them down. If you're new to the channel, welcome. If you're returning, welcome back. Please like and subscribe. Check out behavioranalyststudy.com for all of our study materials, including our combo pack and our question bank app. As always, when you pass your exam, let us know so we can include you in the Sunday shout out. Work hard, study hard. Let's get going. Joy is attempting to determine the most effective level of a timeout procedure she has started to use at her daycare. She sets a time limit for 5 minutes, 10 minutes, and 12 minutes, respectively, on different days. What type of analysis is this? Okay, analyses questions. Typically, you'll be asked about comparative, component, and parametric. Remember, we typically like to think of a component and a parametric analysis as kind of one and the same, right? Because with the component analysis, we're taking a treatment package and we're taking all the components of that package and trying to figure out the effectiveness of each. With a parametric analysis, we're going to take one of those components and try to figure out how much is needed, right? Kind of like the dosage, okay? A comparative analysis, you're just taking two interventions, not part of a package, and comparing them. In this case, Joy is doing what? Well, she has her timeout procedure, so she has her intervention, and she's using different times, 5 minutes, 10 minutes, 12 minutes on different days. So she's trying to figure out what is the best amount of timeout needed. What is the dosage I need of the timeout? What kind of analysis is that? A, comparative analysis. Well, it's not a comparative analysis. She's not comparing interventions, right? She has her intervention already. Same with component, okay? She's already got her intervention, her timeout procedure. What she's doing is she's doing a parametric analysis. How much, right? What's the dosage? How much timeout do I really need? D, she should not be analyzing a punishment procedure this way. Well, you might argue you want to analyze a punishment procedure this way even more, right? Because we need to be very careful with punishment procedures. We need to be very systematic with punishment procedures. What Joy is doing is simply a parametric analysis. How much of my intervention do I need? A doctoral student designs an experiment in an attempt to teach a client how to appropriately ask for a break. The doctoral student implements her independent variable, and the client starts asking for a break. What can be said about this intervention? When you get questions that ask what can be said about this, right? Just be very careful that you're only using the information given to you, okay? Because it takes a lot of information to draw conclusions in our line of work. We know she did an experiment to teach the client how to appropriately ask for a break. So asking for a break is our dependent variable. The student implements her independent variable, her IV, and the client asks for a break. So the IV has apparently led to a change in the DV. And when that happens, what do we say about the intervention? A, there's a causal relationship. So let's be careful with causal relationships. A causal relationship implies the independent variable is the reason the client started asking for a break. And it's very, very difficult to prove a causal relationship, okay? Just this little experiment alone, with just implementing this IV, is not enough to establish a causal relationship. We don't even know if she's withdrawn it, anything like that. However, we can say there's a functional relationship, right? We implement the IV, the client starts asking for a break. There's some sort of relationship there, okay? Because before, the client wasn't. Now, the doctoral student implements the IV, and the client starts asking for a break. So, is it the strongest functional relationship in the world? Probably not. But ever since the IV has been in place, the client started asking for a break. So right now, we can say, well, there's a functional relationship. And later on, maybe we withdraw it, do different interventions to try to either prove or disprove that theory. See, there is no relationship. Well, we can't say that quite yet because the IV is in place. The DV changes. Looks to be a relationship. And then D, it cannot be determined from this information. Well, not quite. We can say there's a functional relationship going on based on the information given. Now, once we have more information, we can make different determinations, but we know she implemented the IV and the DV was effective. That's a functional relationship. You're driving home from school when your favorite song comes on the radio. You start singing as loud as you can because you know all the words to the song. We would consider this a what? All right, public and private events. We recently did a great video on public and private events. Make sure you check that out. We know public events are observable and measurable. We know private are internal, inside the skin, right? What we need to remember is if you're doing something alone, that doesn't necessarily make it a private event. If you're driving home from school and you're singing as loud as you can in your car, that's still a public event because it can be observed. Even if no one's watching you or you're not with anybody, still a public event. So C, a private event if you are driving alone, and D, a public event if someone else is in the car. Those are there just to confuse you. A public event is a public event is a public event, just like a private event is a private event is a private event. Even if you're driving home alone on an empty country road, if you're singing out loud, that is considered a public event because it is observable and it is measurable. A behavior analyst is interviewing a stakeholder in regard to different goals that might be set for the client once treatment starts. The stakeholder tells the analyst that they would like the client to be taught how to keep themselves busy because sometimes the client talks too much. They don't care how the client stays busy. This would most likely fail what dimension of ABA? Now, sometimes we run into this issue, right, where we have people who might not quite understand our purpose or our goal as analysts. And we know our goal is to change socially valid behaviors, right? Teach socially valid skills, change things for the better. In this case, the stakeholder says, well, I just want them to keep themselves busy. They talk too much. I don't really care how. Now, does that sound meaningful to you? To me, it doesn't. Okay. We're not really teaching them a meaningful skill. We're just teaching them to keep busy no matter how that might be. Okay. So it's not really looking to be a functional, meaningful behavior if we just tell them to do whatever it takes to keep yourself occupied so you don't talk too much to your stakeholder. So what dimension will that fail? A, behavioral. Well, staying busy, talking too much, engaging in activity, those are all behavioral, right? We can measure those, we can define those. It would be behavioral. Effective. Well, we might be effective at keeping them busy no matter what, okay? So it could possibly be effective. C, conceptually systematic. Well, if we were to design an intervention, we would adhere to our concepts and our principles. What it probably won't be, though, is applied. It's most likely not going to be meaningful. It's not going to be socially valid. Hey, just go off in the corner, go to your room, go do whatever you want. Just stay out the way, right? Just stay busy, don't talk too much. Not really a meaningful behavior change, okay? So it could be behavioral, could be effective, might even be conceptually systematic, but socially valid, meaningful, and applied, probably not. Kelsey's on the phone with her boss. In the background, she hears her daughter saying, "Mommy, mommy, mommy," over and over again. Kelsey is starting to become annoyed, so she says, "What is it?" to her daughter, and her daughter stops saying, "Mommy." Kelsey now responds quicker in the future to her daughter saying, "Mommy." This is an example of what? All right, reinforcement punishment questions. We know reinforcement increases, punishment decreases, positive add, negative take away. First things first, whose behavior? Kelsey's behavior. What has happened to Kelsey's behavior? Kelsey now responds quicker. Her behavior has increased. We are dealing with reinforcement. Okay. You walk through these questions like this, you can't miss them. So we're dealing with reinforcement. Now, why? Well, Kelsey's daughter was saying, "Mommy, mommy, mommy." Kelsey said, "What is it?" The daughter stopped saying "mommy." So the stimulus of "mommy, mommy, mommy" was removed. Positive or negative? Of course, negative, right? It was removed. It's going to be negative. So negative or removal led to an increase in behavior reinforcement. Put those together, negative reinforcement. If you approach reinforcement and punishment questions like this, can't go wrong. Key always, identify whose behavior you're looking at, what behavior you're looking at, and then the relevant antecedents and consequences. What stimuli was removed? What was added? How did the behavior change? Put them together, you'll get your answer. Kelsey now responds quicker in the future to her daughter saying, "Mommy." This is an example of B, negative reinforcement. Glenn is running discrete trials with his client. He tells his client to find the tiger, and the client touches the bear. He tells the client to find the bear, and the client touches the elephant. What should Glenn try? What's the issue here? Well, the client's making a lot of errors. Errors during the learning process lead to more errors. They become part of the behavior chain. They can become SDs, right? They can become antecedents. Errors, just not helpful. So if Glenn and his client is making all these mistakes, Glenn has to do something. What should he try? A punishment procedure. Well, a punishment procedure should not be the first thing Glenn jumps to, right? We never start with punishment, especially on a discrete trial, finding labels, right? Or finding picture cards. No need for that. Be a prompting procedure. Now, that could be helpful, right? We could go most to least, we could go errorless, and now Glenn is preventing these mistakes from happening. C, a non-contingent reinforcement procedure. We don't know enough about the behavior to know why we would need a non-contingent reinforcement procedure. So a prompting procedure is better based on our information. And then D, a naturalistic procedure. Well, if the client doesn't have the skill in a discrete trial controlled setting, the fact is they likely won't have it in a naturalistic procedure. Discrete trials are typically used for teaching. Naturalistic teachers are used for strengthening and generalization. So based on these repeats of errors, Glenn needs to try maybe a prompting procedure. Which of the following is not considered a behavior under radical behaviorism? Remember, we have methodological behaviorism and radical behaviorism. Methodological acknowledges internal events exist, but they don't consider them behavior in the same way we consider observable events behavior. Radical behaviorism from Skinner came along and they say, well, public events and private events are the same thing. Just because it's not observable doesn't mean it's not behavior. Under radical behaviorism, thoughts and feelings are behavior. So we're looking for the one that is not considered a behavior. A, while doing a crossword, Greg must think hard about 4 across. Doing a crossword, behavior. Greg thinking, behavior. Looks good. Baseball player gets hit with a thrown ball. Getting hit, is that a behavior? Has the baseball player done anything? They have not. Okay. If a dead man can do it, it's not a behavior. Dead man can get hit with the thrown ball. B is not a behavior. C, James feels sad that his dad is going out of town. Feeling is a behavior. D, Elliot orders a salad and an appetizer at dinner. Ordering food, clearly an observable, measurable behavior, a public event, obviously a behavior. B, this baseball player getting hit with a thrown ball is not going to be a behavior. Nothing, the baseball player didn't do anything. Something happened to them. They haven't done anything. Excellent. Thank you for watching. Like, subscribe, check out behavioranalyststudy.com for all of our study materials. As always, work hard, study hard. See you soon.